Kidney stones are one of the top three medical conditions that we treat urologically, the other being infections and cancers. Kidney stones are common in the southeast and southwest. Part of it may be due to the warmer climate, the diet in that area. Dehydration contributes to kidney stone formation, not just in the summer when it's hot, but also in the winter when it's not hot and people don't drink a lot of fluids. The more concentrated the urine, the more chance for the salts in the urine to precipitate out, forming the stones, and then the stones get larger and larger, and if they become symptomatic, then they need to be removed surgically or have a procedure performed. Diet in the southeast is notorious for causing kidney stones. Iced tea, beer, green leafy vegetables, southern fried foods, high salt diet. Some people even say well water, but a lot of it may even be genetic, and there may be some genetic predisposition in the southeast to people that, from this area originally. The signs and symptoms of a kidney stone are pain, generally lateralized to one side or the other, starting in the flank and moving down towards the groin area. The pain would radiate. There's nausea, vomiting, and sometimes if an infection is involved, there'd be fever and sepsis. We are very expedient with the treatment of kidney stones. We can get patients in and out quickly. The emergency room is very attentive, and we have a working relationship with them regarding expedient treatment of kidney stones. They will triage them, treat them, and then we will try to get the therapy going as soon as possible, either admission to the hospital to let them try to pass the stone, or we can get them to the lithotripsy device, the ESWL, extra hydraulic shockwave lithotripter, or we could do the intervention with the endoscopic procedures. Generally, most people can return to work the following day, and some may have some pain medication that they need to take. We give medications to help relax the ureter and pass the stones. Some patients go home with stents or tubes in the kidney that we sometimes leave strings so they can remove them themselves, or we have them come back to the office in a week or two to remove them. When a patient has a kidney stone, if we can collect the kidney stone and we can send it off for an analysis, 95% of the stones, or 90% of the stones, are calcium oxalate, which are very common. There's a few other type stones that fit in that other 10%, and those can be treated medically sometimes with medications. But with the stone analysis, it lets us know what we're dealing with. There's other metabolic evaluations that we can do, collecting urine for 24 hours and doing a blood test, measuring the electrolytes and the chemistry of the urine, the concentration, the volume, and these help us determine what, if any, medications we can put someone on to prevent their kidney stones. And sometimes it's as simply as changing the diet, increasing fluid hydration, and there's some other medications that we can use to prevent stones.